Hi, Ellen and Howie here, and today we're going to talk to you about the designation of healthcare surrogate, a legal document that we work with our clients on every day, really. Ellen, why is the designation of healthcare surrogate such an important document?
So first let's talk about what it is. It is a document in which an individual designates someone to make a decision for them on their health care if they are unable to make it for themselves. So it's not someone who usurps your right to make your own health care decision. And it could be a temporary situation. Maybe they're under anesthesia, or maybe they suffered a stroke or a heart attack, and for whatever it is, even temporarily, they're non-responsive or unable to communicate.
But I've heard that Florida has a law that basically says if you don't have a designation of healthcare surrogate, they've already decided who gets to make the decisions for you, so then why do you need to have the document?
That's true. Florida does have a healthcare proxy statute, and in that statute it determines the order of who makes the decisions for you. But the question is, do you want for the law to determine who makes the decisions for you, or do you want to select your own individual who you feel knows you best and would make the decisions that you would make for your own health care?
And that can be really important because if you have, let's say you have several children and there's somebody who's really good decision maker in the family and who's going to really carry out your wishes, especially when it comes to medical decisions, but somebody else might find it really difficult to make those medical decisions for you. So if the law provides that they can make decisions but they're not really the best decision maker, you can decide by executing the document how that's going to work.
Right. What's tricky is naming all three of your children together, because if you do name all three of your children and they disagree on the course of treatment, then the only thing for the hospital to do or the doctor to do is to seek court intervention. So in our practice, we recommend naming one person, or if you're going to name more than one, to do it by majority. So we already know that there will be a decision regardless of how many are named. We know we have a mechanism for the hospitals and the doctor to follow.
And this is a really important issue. In fact, New York, where I also practice, by law, you're not allowed to appoint more than one healthcare proxy, as it's known in New York. Florida does allow it, but for the reason that Ellen mentioned, it's not a good idea to appoint multiple individuals, because if you have a tie-break situation or people can't decide which direction to go, here you have a healthcare decision that's not being made because of the conflict.
Right, and it's expensive and you have to seek emergency court intervention. And the other thing that we do with our designation of healthcare surrogate documents is they're a work, they're a living, breathing document. And so if you have specific thoughts in mind of how you feel about healthcare, experimental treatments, experimental drugs or not, we specify and we can lay that out very clearly in the document for your healthcare surrogate to follow.
So we here at Elder Law Associates will help guide you through the process of signing a designation of healthcare surrogate so that you do get to choose who makes your medical decisions, so that you can carefully think through who do you want to appoint as your surrogate, who do you want to appoint as your alternate surrogate. And that's one of the things that we help our clients to do, and we're happy to do that for you, and thank you so much for listening.